This is Wellspring, presented by Spectrum Health-Zeeland Community Hospital on 99.7 and 1450 WHTC.
And for this Thursday, November 18th, we are very happy to have on the other side of our Zoom connection, Sara Donkersloot. Good morning, Sara.
Good morning, Gary, and welcome to Wellspring, a live broadcast sponsored by Spectrum Health-Zeeland Community Hospital. I am just very delighted to have Dr. Gwen Unzicker, Medical Director from the Ottawa County Health Department, with us again today. And she's going to provide an overview of the state of COVID in our county and the COVID vaccine that is now available for children. So good morning, Dr. Unzicker.
Morning. Thanks for having me.
Well, thank you for sharing your expertise and your perspective. So, for a time we saw COVID positivity rates declining, and that was encouraging, but it's on the increase. So tell us, what is the current positivity rate?
Right now, the current positivity rate in Ottawa County is right around 25% of the tests that we're doing. So that means 1 in 4 tests are coming back positive. This translates to about 330 cases per day being diagnosed by lab tests. And this doesn't actually even include the home tests that people may be doing, because those are not reported as easily as the ones done by labs or other testing sites.
Well, and that's really an increase because, for a time we were in single digits, correct?
Correct. And even just last week, at a similar time last week, we were reporting about 155 cases per day. So that's a huge increase since last week, up to 330 new cases per day in our county.
So, that's a trend that you're seeing. Are there other trends that you're seeing in, who's being infected and things of that nature?
Right. So one of the concerning trends that we're seeing is that currently we're seeing the most cases in school-age kids and in the age group that most of their parents fall into, which is the 30s and 40s. So this is a shift from earlier in the pandemic when we saw it mostly among the older population. And that's why our conversation about the vaccine that's recently become available for kids is going to be really important.
So, Dr. Unzicker, what concerns do we need to be aware of if cases continue to increase? And, we're entering Thanksgiving when, people are going to be coming together. Talk a little bit about that.
So right now, we're actually already seeing the strain of this increase in cases. So typically, the pattern that we see is when case numbers go up, the number of people getting sick enough to need to be in the hospital also goes up. And then unfortunately, an outcome of that is the number of deaths often go up. And we are seeing this in our hospitals around this area right now. Hospitals are asking community members to do their part to try to stem this tide of spread, because if you get to the point where you're so sick that you need to be in the hospital, you may end up having to wait for a bed in the emergency room or in the hospital. And these are things that we are trying to avoid by helping people know the right thing to do to help decrease the spread of this virus. And as you mentioned, the holidays coming up, we know that people are going to be getting together inside because it's cold outside. They're going to be traveling to other areas. And so we really want to make sure that we're helping people have the tools that they need to be as careful as possible and keep the spread as low as we can get it.
So you talked about those tools. What can people do to help change the trend?
Number one is, if you are eligible to get vaccinated, get vaccinated. Unfortunately, the number of cases that we're seeing is still the largest number of people that are infected and severely ill and hospitalized are those that, for whatever reason, haven't received the vaccine. And that includes those that until now have not been eligible for the vaccine. And so again, we would just so strongly encourage you, if you have questions or concerns about the vaccine, talk to your trusted healthcare provider, make sure that you're seeking out that information, but we know that these vaccines are safe and effective and are really the most effective way that we can help prevent this spread. And then the other tried and true things that we know of that I know we're all sick of, but they still work: wearing a mask, washing your hands, trying to stay in a more ventilated area if possible, and most importantly, stay home if you're sick, even if it's just the sniffles, stay home.
I think that that's a really interesting perspective because, speaking from a hospital perspective, we had very, very few flu cases last year. And, already, Spectrum Health is seeing flu in our area. And, you think about it, we were wearing masks last year. We were washing our hands. I mean, that is another concern on top of having COVID. Now we have the influx of flu coming in.
Yes, and we are starting to see more influenza here. They are seeing more of it on the other side of the state currently, but that is another good reminder that the COVID vaccine is not the only important vaccine this time of year. The flu vaccine is also very important. And just another reason, again, if you have any symptoms of sickness, it's important to stay home, seek care if you're very, very ill, but don't just try to tough it out and go to Thanksgiving dinner, even if you've got the sniffles, because that is how these viruses spread.
We talk about herd immunity. Just speak to that. How are we doing in efforts to reach that number?
Right. So herd immunity is basically just a way of describing if enough members of the community or the herd are immune to a disease, then the disease has a harder time spreading from person to person, right? And there's no magic number for when we reach that. For certain diseases, it's a higher percent of people being immune than others. For COVID, we don't really know what that number is going to be yet. We do know that right now in our community, we have 61.6% of those that are eligible for the vaccine have at least started the process. And about 56% of those that are eligible have completed the process. So that's great, but we still have a lot further to go, as is evidenced by the situation that we're in now.
Before we talk about the childhood vaccine, just want to talk a little bit about the booster. If you're eligible to get the booster, go out and get it. I think that's what you would recommend?
Yes, we would absolutely recommend that, because we do know, again, that as we learn more about a disease, we get more information. Sometimes those recommendations change. And we know that getting that booster shot gives you that extra bonus immunity that you need, again, to try to help fight off that infection if you get exposed.
We're talking with Dr. Gwen Unzicker, who is the medical director for the Ottawa County Department of Public Health. No phone calls, please, in this episode of Wellspring. Sara, I do want to ask Dr. Unzicker about the fact that it looks as if the booster with Pfizer will be adopted shortly by the FDA and the CDC. The other major providers are also doing it. We've been told if you've gotten maybe Moderna as a vaccine, you can still get the Pfizer. Also, do you need to go to the same place where you got the initial vaccine to get your booster, or can you go somewhere else as long as you have the card?
Great questions. The answer to that is, although the CDC still recommends that you kind of stick with the brand that you originally got, that is not by any means a requirement. So no matter what vaccine series you got to start with, you can get any of the available vaccines at any available location. You don't have to go to the same place. Having your card is helpful, but even if you go somewhere within the state of Michigan, if you got your first vaccines here in the state of Michigan, they can look that up and they can verify that even within our state records. So we want to make it as easy as possible with as few barriers as possible for people to be getting their vaccines and their boosters.
I got my vaccine this week, Tuesday. And when I had my Moderna earlier in February, when I had my second one, I ended up running a slight fever, and I was so thankful this time that I had nothing. So if people are out there and saying, oh, gee, I don't know if I want to get it because I had some, that shouldn't be a fear, correct?
Correct, yes. And the side effects are what we are seeing basically as a result of the immune system doing what it's supposed to do. I like to compare it to having a really good workout. You know, when you go to the gym and you've had a great workout, you might be really sore the next day, but that's actually a good thing because that means your muscles did what they were supposed to do. And it's the same with the vaccine. If you get some of those symptoms after the vaccine, that's actually a sign your immune system's doing what it's supposed to do. And it doesn't feel great, but at least you can be confident knowing that that means your immune system got a great workout and is doing what it's supposed to do.
And if you don't have the side effects, that's okay too, correct?
Correct. Yes. Yes.
Okay. So that leads into the childhood vaccine.
Yeah.
Tell us a little bit about it. It's Pfizer. Who is it for?
Correct. So the most recent age group that's been approved to receive this vaccine, or I should say authorized, is the age group between 5 and 11 years old. And so this is the age group right now where we are seeing an increase in cases. And so this is perfect timing, I guess, as perfect as we can get to help protect these kids that previously didn't have the option of having this protection.
You know, some people would say, you know, COVID-19 has had minimal impact on children so far. And they would say, you know, I don't think my child has to be vaccinated. How would you respond to that?
So it partly depends on how we define impact, right? And there are a lot of areas where kids in this age group have been impacted just in terms of their own sickness. We know that there have been 1.9 million kids in this age group that got infected. About 8,300 of those kids ended up in the hospital, and then a third of those kids ended up in the ICU, which is not an experience that any parent or child wants to have. We know that unfortunately, at least 94 kids in this age group have died from COVID. And then there are other complications that can happen even in those that don't have these prolonged courses. But in addition to that, over 1,800 schools had to close in August and September of this year because of COVID. And that affected about 933,000 kids. So even if they weren't sick, they may have had to quarantine, they may have had to switch to remote learning or miss out on some days. So that's an impact. We know also that kids can spread it. And where this really hit home for me was when I read about the fact that there is an estimate that over 140,000 kids in the US have lost a parent or a caregiver because of COVID. And over 1 million kids worldwide have lost a parent or a caregiver. So really, what are the goals of this vaccine in this age group? We want to protect them from illness. We want to prevent transmission. And then we want to promote the return to activities in school, because an added bonus of getting the vaccine is you won't have to quarantine if you get exposed to COVID. And that could have huge implications for this age group. So this is a really important development.
So tell us about, do they have to have one shot or two shots?
Right. So they will need to have 2 shots, 3 weeks apart. The dose of the vaccine is actually smaller for this age group. What they did was they looked at what is the smallest amount of medicine we can give kids in this age group to get their immune system to do what we want it to do. So the dose is about a third of that people ages 12 and older get, but it still is right now 2 doses, 3 weeks apart.
If someone you're bringing your child in for the COVID vaccine, can they have the flu vaccine at the same time?
That might depend on the facility where they're getting the vaccine, just what they have available, but medically, absolutely. We are recommending that people get their COVID vaccine along with any of their other routine vaccines, if that is most convenient for the family. And that includes the flu vaccine, which we are strongly recommending at this time of year.
So, Dr. Unzicker, can they get the vaccine at the health department?
Yes, they can. And they are also able to go on the website vaccinatewestmi.com, and that will give them all kinds of information about where the vaccine is available, whether they need an appointment, and all the information that they need to make sure that their child is vaccinated. And in addition to that, I would like to just give a shout out. We have vaccinated over 1,400 kids in Ottawa County in school-based clinics. So shout out to the schools that have been hosting these clinics. That's a third of the kids so far that have been vaccinated in Ottawa County. All told, we've done 3,400 doses of the vaccine in kids in this age group just since it's become available. And so we are super excited about that.
Thank you very much for being here. And next week, we won't have Wellspring because it's Thanksgiving. And on the behalf of Spectrum Health-Zeeland Community Hospital, we wish you a blessed Thanksgiving. So 2 weeks from now, we'll see you. Until then, Spectrum Health-Zeeland Community Hospital wishes you well.